Ladies and gentlemen, please welcome your Master of Ceremonies, Dr. Oscar Howell.
Anyway, welcome to the second annual recognition event. It's certainly my pleasure to be here as the Master of Ceremonies again. Hopefully I'll do a better job at that than I did with that card. You know, we're all pretty proud of you, and you guys do a wonderful job. This is our chance to really say thank you to you. This year we have 70 individuals who have been nominated. And you know the real magic is that you're nominated by your peers, the people who work with you every day and appreciate what you add. So this year we've changed it up a little bit. We've added another element, and that's the Lighthouse Grants. $10,000 to support innovation and encourage new approaches to work at Eastern Health. These awards were first presented in 2007, and after today, 43 grants will have been awarded for a total of just over $365,000. Here to present this year's grants to the successful applicants is Carmel Turpin, Vice President with responsibility for the grants program. By the way, don't you love her lovely straight hair? It's brand new. And everyone tells her she looks 10 years younger. By the way, we'd like the award winners to come up from this side and go out that side, please.
Thank you, Oscar, I think. And I just want to say what a fabulous opening that was. And if you just bear with me a second, I do want to recognize Susan Bonnell, the Director of Employee Communications, who really is responsible for what the show is that you're going to see this morning. And Susan has a great team behind her in corporate communications. So Susan, wherever you are out there, certainly thank you. It's a pleasure for me to be here to present the Lighthouse Grants, which provide up to $10,000 to support innovation and encourage new approaches at our work at Eastern Health. The awards were first presented in 2007, and after today, 43 grants will have been awarded for a total of just over $365,000. Awards such as these provide a great opportunity for individuals and teams to demonstrate Eastern Health's values of excellence and connectedness. The history of the region covered by Eastern Health is one of innovation. It is through that innovation that new lands were discovered, new technologies developed, and new solutions found. Eastern Health continues this tradition with its Lighthouse Grants for innovation, exploring and implementing new approaches to support us on our path towards healthy people, healthy communities. As Oscar indicated, the purpose of the Lighthouse Grants is to support innovation that will encourage new approaches to the work of departments, programs, divisions, professional groups, and teams. Innovation can be defined in any number of ways. The introduction of something new, a new idea, method, or device, a new idea that needs to be implemented, and innovations that emphasize projects that impact on patient, client, and resident care or well-being, and the well-being of healthcare workers are particularly welcome. In the first year the grants were offered, the Child Health Program received a grant to develop and implement a multimedia psychoeducational program for the prevention, identification, and management of eating disorders. According to Joanne Sims, nurse practitioner with the program, this project has evolved to become more than what we ever expected. The Lighthouse Grant Awarder provided the impetus for a successful provincial initiative. Joanne is not the only one to acknowledge that without the grants, projects may never have gotten off the ground. In one of my department's employee communications, a project to pilot digital signs for hard-to-reach employees was only possible because of the leverage of the grant provided. In 2009, Susan Dyke from the Development and Rehab Division of the Children's and Women's Health Program received an award for an educational resource for the families of newborns with cleft lip and palate. This project has already been successful beyond our original expectations, said Suzanne. It has been translated into French, and copies have been requested by provinces from here to British Columbia. Lighthouse grants often have a lasting impact. In 2009-10, the neurosurgery unit at 5SB Health Science Center received an award to initiate a protocol on managing challenging behaviors of patients with traumatic brain injury. And according to Renee Hillier, the education received and the projects developed will enhance the care and interventions provided to individuals with TBI and their families for years to come. Recent efforts to increase awareness of and uptake of the Lighthouse Grants for Innovation have been successful, as evidenced by the 30 grant applications we received for the 2011-12 awards. This is more than double the number received last year. And I certainly want to thank Marie Duffett, who's been working with the committee and for the work of the planning department in promoting the Lighthouse Grants. All grants are reviewed by the Lighthouse Grants for Innovation Review Committee, which has broad regional representation. Applicants are advised to review Eastern Health's strategic plan, organizational values, and departmental operational plans to ensure the innovation being proposed is consistent with the direction of the organization. To ensure we are keeping track of successes and areas where projects didn't go as planned, recipients are required to submit an evaluation within 16 months of receiving the award. So who will be reporting on success next year? It is time to announce the recipients of this year's Lighthouse Grants for Innovation. I am pleased to announce that there are 5 winners this year, each receiving a grant for the full value of $10,000. We begin with a grant for the development of an instructional DVD. For patients undergoing breast cancer surgery, postoperative physiotherapy has been shown to speed recovery, help regain range of movement, and assist patients in returning to normal living. In 2011, over 260 breast cancer patients were seen pre- and postoperatively in outpatients just at St. Clair's. Breast cancer surgery is certainly stressful, and patients have repeatedly stated how helpful it would be to have a resource to take home with them to help them remember the information, tools, and tips being offered to them during physio. A great and simple concept, innovative, and useful to clients. And I'm not sure if Jill Severier has arrived. She was going to accept on behalf of the team. I don't think she's here, so Marie Duffett will accept the award. Oh, sorry, she's coming. Many patients live for years after it is determined that they are palliative. From April to July 2011, the Palliative Care Program piloted a remote monitoring online program called the Edmonton Symptom Assessment System. The pilot demonstrated that palliative patients could be safely monitored at home using this web-based symptom assessment tool. This grant will allow the team to adopt this process into part of the regular care they provide, advantaging both patients and the healthcare system at large by allowing palliative patients to report their symptoms and progress from the comfort and safety of their home. Please join me congratulating Dr. Susan McDonald, who will accept this grant on behalf of the team.
Just to let you know that we're actually thinking of expanding this. We are putting the money towards the development of an app which will be for your iPhone, and we are planning to expand it into the chronic care population. Keep people out of your emergency room. Thank you.
Certainly innovation at work there. If you have ever had a sleepless night while waiting to hear the results of a diagnostic test, then you will surely appreciate the innovative and patient-focused proposal resulting in our next successful grant. Tissue diagnosis is complex and has many steps, each contingent on the other. What about if there was a way to reduce the wait times for results from months to days, all by investing in a process improvement project? This is the goal of the anatomical pathology team at the Health Sciences Center. The team will explore and implement process improvements they hope will result in significantly reduced wait times. Please join me in congratulating Heather Kearns, who will accept this grant on behalf of the team. Heather is a new arrival to Eastern Health. I met her for the first time yesterday and has come to us from the U.S., joining Dr. Steve Rabb and his team at the lab. We're certainly glad to have Heather with us. Last week, I was in Montreal, where I proudly watched my son convocate from McGill University. That's phase 1 down, at least, hopefully out of my bank account. But it only seems like yesterday that I struggled to find him a safe and enjoyable place to go during summer vacation. The Outreach Program and Prevention Services team of the Mental Health Program have been conducting research on this topic, including community-focused groups and surveys, and they discovered that youth aged 13 to 17 have very few options in summer, and for some youth, unstructured and unsupervised time can increase the risk of poor decision-making and problem behavior. Engaging youth in structured social activities is consistent with best practices in prevention and promotion. The proposed solution is a 7-week summer program with supportive booster sessions throughout the year. Please join me in congratulating Deanne Fitzpatrick, who will accept this grant on behalf of the team. Shy people. Our final grant is to support the continuation and expansion of an already successful health promotion initiative. In 2011, the health promotion team started Take Care Down There, a project designed to increase awareness about the importance of condom use amongst 18 to 30-year-olds. This grant supports an increased focus on college and university populations through partnerships with MUN, CONA, and other learning institutions in the development of a social networking tool. Please join me in congratulating Anita Forward, who will be accepting the grant on behalf of the team. I could have used an example of my son again then, but he would have been terribly, terribly upset with me. There were very many innovative proposals submitted this year, but unfortunately we could only approve 5. For those unsuccessful applicants, please do not hesitate to continue to submit proposals. We want you to generate ideas, we want you to be innovative, we want you to be creative. Congratulations to all the grant applicants and winners, and I encourage you to apply next year. Who knows, your creative idea may result in sustainable change in our organization. Thank you, and I hope you enjoy the rest of this special event.
I think she's going to get me back for that hair comment. I dread the next interview I have to do with Carmel there. So what's in a year? 12 months, 52 weeks, 365 days. At Eastern Health, we measure our year in quarters and in shifts. We section our days before coffee, after lunch, and we count everything from beds to residents to community encounters, from pills to packages and everything in between. At Eastern Health, a year is made of many moments, and in 2011-12, there were many memorable moments. Our year begins in April and ends in March. And as you know, last year was one season, rainy season. Here to remind us of the accomplishments of last year, please join me in welcoming my colleagues, Pat Cochneau, Alice Kennedy, and Catherine Chubbs to talk about our accomplishments of last year.
Good morning, everyone. Certainly an honor to stand before you this morning on this wonderful occasion and to have the pleasure of recounting the last year's worth of achievements and accomplishments.
Yes, Catherine, it's hard to believe how quickly a year goes by, especially at Eastern Health. In April 2011, Eastern Health released the fourth in a series of regional needs assessments in my neck of the woods. The Discovery Zone Community Health Needs Assessment focused on determining the big picture, which has resulted in a strengthened relationship with the school board, new energies in primary health care, and greater attention on aging and long-term care needs in the Clarenville-Bonavista Vista area.
In April, we encouraged the public to become organ donors during Organ Donor and Tissue Awareness Week, and we celebrated our volunteers, an integral part of the healthcare team during Volunteer Appreciation Week. Many of you were moved by the story of Donna Kavanagh, a volunteer in the palliative care unit in St. John's, whose story was featured on the internet. Donna said, "On the palliative care unit, I have felt enriched and rewarded. Someone once said that when we light the path of another, we cannot help but light our own. My path is very bright indeed. What I give is returned to me tenfold."
It's volunteers like Donna that remind you of what a joy it is to work in healthcare. May is one of our busiest months for celebrating weeks, months, and special occasions. For example, it's Canada Health Day, Occupational Health and Safety Week, National Physiotherapy Month, Speech and Hearing Awareness Month, the International Day of Families, and World No Tobacco Day, and I am the smoking queen. The list goes on.
That's right, Pat, and of course it's also National Nurses Week. And as always, our Leaders in Nursing host a fantastic event that celebrates so many nurses. Many nurses receive recognition at this event for their leadership and their skills, and we congratulate you on all of your accomplishments. Similar events in many other disciplines are also held across our region during the year, and there's a gala night for allied health professionals in the fall that we help celebrate some accomplishments as well.
In May 2011, Eastern Health also launched a client satisfaction survey. The survey will conclude this fall, at which point approximately 16,000 surveys will have been distributed to individuals who receive care in acute care, emergency services, mental health, rehabilitation, and long-term care. The opinions of those we provide service to are critically important to us as an organization. As Ms. Kaminsky said to the media last May, will help us to enhance care, hopefully resulting in more satisfied clients into the future.
It's hard to believe that it was a year ago, almost to the day, that we were here at the Convention Center waiting for the announcements on the CEO Awards of Excellence and enjoying an afternoon of basking in the glow. Last June, Eastern Health held the first of many recognition weeks. The result of feedback from you was that the formal and informal recognition are a priority for you and your colleagues. 66 employees were nominated in 7 categories, and I understand that the numbers are up for this year, as Oscar has indicated earlier.
Of course, Recognition Week was more than this event. There were shout-outs on the internet, star walls in our facilities, e-cards, and cakes. One of my favorites. I also understand that across the organizations, teams took the opportunity to come together and celebrate one another. June is also the month that the organization presents its annual Lighthouse Grants for Innovation, which Carmel certainly just did.
And I'm pleased to see that today we celebrated those grants as a part of this occasion. And again, I'd like to congratulate you for all of your creative thoughts and innovative ideas. Last year's winners included the Friendship Corner, featured in the last edition of Connect magazine, Lean in the Lab, a project to increase efficiency in the pathology lab, a wheelchair skills workshop, and a grant for a community partnership with the YMYWCA, both presented to our physiotherapists at the Miller Centre. Funding for the Adult Stroke Unit for Educational Materials was also a winner, and a grant for a workshop on motivational interviewing. Congratulations to all the recipients.
Well, the weather outside was certainly anything but delightful, but the summer of 2011 was certainly full of praise and accomplishments. The Heart and Stroke Foundation offered a special commendation to the stroke unit at St. Clair's, and the Sisters of Mercy proudly celebrated the reopening of the renovated chapel at the site. The Trinity Conception community celebrated the U-Turn Drop-In Center, which was officially opened in July, and the Dr. A.A. Wilkinson Memorial Health Center celebrated 75 years of service.
And we certainly have had our share of things going wrong. Despite disruptions in phone service, water main breaks, renovations, equipment failures, and a postal strike, Eastern Health still managed to implement many vitally important new projects.
We did. We hired patient navigators for the Provincial Cancer Care Program. 7 oncology nurses focused on helping more than 2,000 new patients referred to the program each year, helps them navigate through the oftentimes confusing and frightening process of cancer diagnosis, tests, and treatments.
We released our new employee promise and our statement of rights and responsibilities for clients, patients, and residents.
And after 6 long years of analysis, review, changes, and improvements, we resumed ERPR testing at our lab in St. John's. Huge accomplishment. This effort demonstrates our commitment to quality and the dedication of our staff, our physicians, and our managers to provide quality, safe testing to the people of Newfoundland and Labrador.
The Board of Trustees announced the launch of the 5th needs assessment in the Trinity Conception area. We are getting ready to release the results of this in the next few weeks. In the fall, our planning team was presented with the Primary Healthcare Researcher of the Year Award from Memorial University for their work on the needs assessment, a well-deserved acknowledgement.
And during the summer months, we publicly released our new strategic plan and our new theme, Together We Can. Let's take a look at the organization's new video.
Eastern Health, Newfoundland and Labrador's largest health authority and one of the province's biggest employers, providing hospital, community, and long-term care to the people of our region and specialized services to the entire province. 13,000 employees working towards a single vision: healthy people, healthy communities. Focusing on quality and safety, improved access, population health, and a strong, sustainable system. Together, we can.
Together.
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 Together we can.
At Eastern Health, we serve more than 290,000 people in the Eastern region and provide high-level services to all the residents of our province. The Eastern Health region stretches from St. John's to Port Blandford and covers the Avalon, Burin, and Bonavista peninsulas.
I want you to close your hand, not too tight.
And we're not just big, we're unique. We treat men, women, and children throughout their lives and in all circumstances. This full continuum of healthcare allows for a more seamless delivery of Eastern Health's hundreds of programs and services. Our services include public health, home and community services, long-term care, hospital care, as well as unique provincial programs such as cancer care, cardiac care, child and women's health, and mental health and addictions. All delivered by a dedicated team of employees, 13,000 strong.
Good morning, Eastern Health. Catherine speaking. Certainly, one moment.
Eastern Health is rooted in the communities it serves. We believe that when individuals are healthy, communities are healthy, and we are committed to working with all community partners to realize our vision.
How are you doing, Melissa? Good. How are you doing?
Okay, pretty good, bud.
Excellent. So have a look now before we get started.
All right.
Looks good.
Every member of the Eastern Health team plays an important role in providing the best care possible to our patients, clients, residents, and their families. To accomplish that, we are guided by a common set of values: respect for those we serve and for each other; integrity, valuing honesty and open communication; fairness, making sure our resources are distributed equally; connectedness, recognizing and celebrating the strength of each person and service that make up the whole of Eastern Health; and excellence, pursuing and promoting excellence in all that we do. At Eastern Health, our aim is to improve our processes and outcomes, whether that is with advanced paramedicine training to provide better on-the-spot care in emergencies, or by opening primary health care clinics where they are needed most. The goal is to improve both care and access to care by offering the required services when and where they are needed. Our employees are our greatest resource. Our teams of nurses, physicians, employees, and volunteers offer their best efforts every day and in every circumstance, often going that extra mile to ensure the necessary care is given.
Okay, we're all set to go there.
In healthcare, change is constant. As services evolve and technology advances, our physicians and staff bring new ideas and innovations to life. They translate strategy into action.
The tumor's in his tonsil. This should be pretty stable right around here.
Okay, so if I scan from the top of the head to the crown.
And we teach tomorrow's healthcare providers. At Eastern Health, we value lifelong learning, all with an aim to improve processes, approaches, and outcomes, and to improve the quality of work life at Eastern Health. We strive for a healthy work environment where staff are encouraged to take initiative and try new things for the benefit of those we serve. An atmosphere of trust and confidentiality is essential in healthcare. Our employees are trustworthy and discreet and protective of their patients' health and health information. This dedication to duty holds true through the full continuum of care at Eastern Health, from our very youngest patients to our most senior residents in our long-term care facilities. Bringing our best to those we care for takes a shared commitment on the part of all those who call Eastern Health their professional home. Teamwork is essential to a positive work environment and to a positive outcome for our residents, patients, and clients.
Together, we can help children move better, breathe deeper, and become stronger.
Together, we can offer primary and mental health care to people
right where they are.
Together.
together.
Together, we can use the latest technology
to provide the best possible cardiac care.
Together, we can make sure that supplies needed for quality health care are stocked and ready to go.
Together, we can provide safe and accurate radiation treatment for our cancer patients.
Together, we can provide a clean and safe environment for our patients and residents.
Together.
Together?
Together, we can make sure information is transmitted efficiently. Together, we can respond to emergencies
Quickly and effectively.
Together.
we can.
Wow, folks, well, doesn't that make you proud? Congratulations to Carmel and her team for such a great job of representing the work that everybody does at Eastern Health. Further, demonstrating that together we can achieve whatever we set our minds to, in late August, we were notified by Accreditation Canada that the organization had received full accreditation status. Suzanne Larocque, chair of the Accreditation Decision Committee, said that this achievement demonstrates your organization's determination and commitment to ongoing quality improvement. We applaud your leadership, staff, and accreditation team members for their efforts and dedication to the provision of safety, quality health services. But who demonstrates that dedication, leadership, and commitment to quality of care? You do, each and every day, and in every interaction.
Yes, Alice. It's people like Marie Fitzpatrick and Dan Johnson, respiratory technologists, who successfully completed all educational criteria and challenged a national examination required to be recognized as certified hyperbaric technologists. Congratulations.
It's the members of our cancer registry team who achieved certification at the silver level from the North American Association of Central Cancer Registries. It's our nurses at Carbonear General who raised over $1,500 to walk in the Relay for Life in honor of their friend and coworker, Margie Howell.
It's National Diabetes Volunteer of the Year, Dawn Gallant, Royal College Mentor of the Year, Dr. Elias Bartelos, and Specialist of the Year, Dr. Kara Lang.
It's Ray Down, a physiotherapist with Eastern Health's pulmonary rehabilitation and cardiac rehabilitation programs, who successfully attained designation from the American College of Sports Medicine. And Michael Osborne, an X-ray technologist at St. Clair's, who got the highest mark in Canada on the Canadian Association of Medical Radiation Technologists registration exam.
And we know there's so many other accomplishments that we haven't noted, but we are very aware of them. And we're so proud of your individual and your team efforts. Thank you so much. In September, with the memories of Igor fresh in everyone's mind, the organization prepared for Hurricane Maria, luckily to have little impact on us and our clients. September also marked the first of hopefully many ethics education days on the theme of the individual's right to privacy and the public's right to know.
October marked a return to employee town halls, with Vicki traveling to multiple sites across the entire region to meet with staff and talk about our new strategic plan.
Clarenville was the place to be for October, as Dr. G.B. Cross celebrated 25 years, and the organization partnered with the Eastern Health Regional Wellness Coalition and the Wellness Coalition Avalon East to host Wellness Under the Big Top, a conference showcasing community wellness initiatives in the Eastern region.
Well, now, Alice, you always know that Clarenville is the place to be. Although it's not as good because I'm not there as often anymore. I don't get to spend as much time in Clarenville as I'd really like to. But October is Health Month at Eastern Health, with numerous healthy workplace and quality care events from Healthy Workplace Month to Patient Safety Week. October was also the month that Eastern Health first became involved in More OB, an internationally recognized patient safety improvement program aimed at enhancing patient safety and quality care in maternal and newborn services.
Well, Pat, by November, when it was clear that we were not in fact going to get any summer for 2011, Eastern Health employees settled in for the long, cold winter with our seasonal influenza vaccine campaign, with clinics in many community offices around the region.
Alice doesn't seem bitter at all about the weather. I guess she's glad we have some nice sunny weather today.
Well, being from Placentia and living in fog about 300 of the 365 days of a year, I guess, what can I say?
So we're warmed by the sun, but we're also warmed by the news that Eastern Health has passed the prime occupational health and safety audits for the years 2008, 2009, and 2010. PRIME is an incentive program offered by the Workplace Health and Safety Compensation Commission to recognize good occupational health and safety and return to work practices and programming. With this success comes a whopping $1.1 million refund. Congratulations to the Occupational Health and Safety team and all the members of our 51 OH&S committees for the time and effort spent and dedication demonstrated in helping to ensure that we meet the many requirements of this program.
December was a month of giving, and it is a month of giving, and Eastern Health staff never disappoint us on this account. Our ambulance staff organized Pack the Back, a public toy drive to stuff the back of an ambulance with toys for the needy. Nurses in Carbonear donned traditional garb and entertained the public at the Bay Roberts Christmas Parade. George Butt's going to join them next year, I hear. Staff on Bell Island pulled together 23 ampers for the community, and all our staff pulled together to donate $8,300 for the Community Food Sharing Association by making donations at our roast turkey dinners. What an accomplishment.
And these are just examples of the many individual and team efforts Eastern Health employees make during the holiday season to help those less fortunate. The new year began with a bang as we received word that Eastern Health's Dental Services Program had been awarded a 5-year accreditation status by the Commission on Dental Accreditation of Canada. Accreditations such as this one are a way we measure that we are providing good quality care to the people we serve. So of course are the many letters, commendations, and feedback we receive. But sometimes it's easy to forget all that we accomplish in the run of a year.
That's right, Alice. Many of our initiatives, and certainly most of our initiatives, have had a positive impact on our patients, our residents, and our clients, and the communities we serve. In terms of access and wait times, for example, ER access has been improved and wait times have been reduced by hiring more nurse practitioners, yay, expanding physician hours, and renovating spaces. We have also reduced patient wait times for CT services and ultrasound with the addition of technologists and expanding the hours in those areas.
We're installing new analyzers for most routine lab testing across the region, which will ensure that standardized testing is performed using standardized operating procedures, enabling us to compare results regardless at the site. New technology is also enabling real-time discussion and consultation between pathologists throughout the region for the purposes of discussing difficult pathology cases.
New treatments such as rapid ARC, an advanced treatment option for prostate cancer patients requiring radiation therapy, means shorter and more comfortable treatment for patients and reduced wait times to access therapy. This year, we also implemented a central intake system for orthopedic patients, which has resulted in considerable reductions in wait times for our patients. Median wait times have decreased by 69% for our highest priority patients and 47% for the lower priority patients. The addition of 2 operating room suites at the Health Science Center has significantly increased surgical capacity, resulting in an increased number of surgical procedures performed. And the establishment of a pre-admission clinic and a creation of chronic pain service in Carbonear means decreased cancellations for elective surgical procedures and improved access to interventional pain treatments for chronic pain patients.
In 2011, we increased capacity at the Bjorn Peninsula Healthcare Center for dialysis. Currently, there are no patients waiting for dialysis services on the Bjorn Peninsula. Registered nurse recruitment initiatives have met with great success in Clarenville. GB Cross currently has a stable registered nursing working complement, which has increased access for patients and improved work life for all staff. It must be the weather in Clarenville.
It's the place to be.
It's the place to be. And in 2011, the Healthy Beginnings postnatal and early childhood follow-up program was standardized across the region and enhanced to reflect an increasing complexity of care issues. Today, all breastfeeding mothers and their babies are offered a home visit after delivery.
Yes, Alice, again, and this is just an example of the many quality projects impacting the organization, our clients, our patients, and residents in a positive and productive way. There are just so many more out there.
In February, we celebrated the Healthcare Foundation, celebrated with them as they brought to close a campaign for cardiac care that began in 2009. Give from the Heart is one of the many campaigns run by our 7 foundations that supports the work that we do. Invaluable. Thank you and congratulations to our foundations for their continued success and efforts.
And thank you to our community partners who support our organization. Of course, we also need to acknowledge the many efforts staff make to raise funds for their communities and the communities we serve. It makes sense that we would want to give back, and I'm proud to say that we do.
Thanks, Pat. That's right. For example, in February, St. Luke's Home held its 3rd annual Pancake Breakfast fundraiser to aid in the fight against homelessness. And in March, 7 nephrology nurses and 1 social worker participated in the 40th annual Shamrock Half Marathon in Virginia. The Rock Renewal Runners, sponsored by Dr. Pat Parfrey, successfully completed the 21 kilometers on March 18, 2012, in an effort to bring awareness to kidney disease and the benefits of exercise.
While Virginia is certainly a long way to travel, consider the many Eastern Health employees and physicians who in this past year traveled to hurricane-ravaged Haiti. We asked Robin Noseworthy of the Organ Donor Program to tell us about her experience for Thanksgiving, and she said, "Here at Eastern Health, many staff experienced increasing demand of providing good health care. Her experience in Haiti has helped her to put this stress into perspective, not to disregard it or belittle it, but to have greater patience with it. We have come so far in comparison to Haiti, and we will continue to improve with time. But we have to take time to be grateful for what we've accomplished and for the efforts we continue to make." Thanks, Robin, for giving us that feedback.
We do have a lot to be grateful for when you look back at it, and I guess my personal motto is an attitude of gratitude, so I try to share that wherever I go. 365 days, 8,700 hours, 525,600 minutes. How do you measure a year?
Well, Catherine, at Eastern Health, we certainly could measure our time in challenges faced and opportunities lost. But I'm glad that today and every day, we measure time in missions accomplished and moments won.
Congratulations for your part in our many successes and for believing that together we can.
Together we can. Minutes, 525,000 moments, oh dear. 525,600 minutes. How do you measure a year? In daylights, in sunsets, in midnights, in cups of coffee, in inches, in miles, in laughter and strife. 525,600 minutes. How do you measure a year in the life? How about love? How about love? How about love?
Good morning. I'm Marilyn Thompson, Vice President with responsibility for Human Resources and the lead executive for recognition through Eastern Health. So it also means this morning that I'm a pretty proud person. We held our first recognition event last year when I was brand new to the organization. And throughout the year, I've watched as the recognition committee and my staff in Human Resources, especially the Policy and Program Development Department, have organized and hosted a number of spectacular recognition events. From scholarships in the fall to service in the spring, and now CEO awards in the summer. We are kept pretty busy through the year with a full recognition calendar. It's always a challenge to single out any individual through the many events that we have, but we need to recognize a couple of people in particular who work diligently throughout the year to make all of our recognition events happen. Renee Woodland and Jose Dumas. Could you stand? Thank you for what you do to make every recognition event a success. And thank you to everyone in Human Resources who lend a hand and help out wherever requested and as needed. Your efforts are truly appreciated. Of course, recognition is a team effort, and I would be remiss if I did not acknowledge the full team who support our staff. This year, our recognition committee expanded to include many new members, and their input, guidance, and suggestions make our programs more robust and complete. Could I please ask the members of the recognition committee in attendance today to please stand and be recognized? Thank you. And a very special thank you to corporate communications team, who I'm pleased to report won a provincial award of merit for the recognition week last year through Eastern Health. So congratulations to everybody in corporate communications. I'd also like to recognize the many individuals, teams, managers, and directors who make special efforts each and every day to create a culture of recognition in Eastern Health. Formal programs like the Healthy Workplace Champions Program, the Good Catch Award, and the WOW program, as well as the annual Nurses Gala and the Allied Health Professionals Recognition Program, keep the momentum going all year, everywhere. Recognition Week has been designated to take time to look back on the work that we've accomplished over the past year and give ourselves a little pat on the back. Although Eastern Health has experienced its fair share of challenges, its people, our employees, always bring the very best care and service to our patients, residents, and clients. I believe the formal recognition program demonstrates our desire and commitment to recognize our employees for their effort and their dedication. However, we have heard clearly that what our employees really want is to feel valued by their peers, their managers, and the organization. Eastern Health is proud of its people and believes that formal recognition is important, but we also know that to ensure employees feel their contribution is valued in the workplace, more informal recognition is needed to create the right culture. So what's informal recognition? Informal recognition is about paying attention to the work of others and valuing their contributions and telling them. It's the day-to-day acknowledgement from a manager, a peer, or a colleague. It's about appreciating the good work that people do by thanking them, giving them a pat on the back, maybe a small acknowledgement, or celebrating as a team the completion of a successful project. I hope this week you've taken the opportunity to give a shout out to a colleague through the intranet. If not, there's still time. Be sure to recognize someone whose efforts improve the workplace or contribute to the quality of care and service that we provide. And I encourage you to participate in one of the many program and departmental celebrations that will be occurring this week throughout the organization. We're very pleased this year to be introducing an expanded program to recognize employees for milestone years of service. We've always celebrated 25 years and up, but this year we're also recognizing employees for 5, 10, 15, and 20 years of service. You asked for this recognition, and we're very pleased to be able to provide it. Which brings us to the reason for this morning, and just a reminder to the recipients of the awards, because you're all winners. But the recipients, if you could come up through the right side and then go across and down the left stairs, that would be appreciated. Now it's my distinct pleasure to welcome our President and CEO, Vicki Kaminsky, who will present the CEO Awards of Excellence for 2012.
Well, thank you very much, Marilyn, and in fact, everybody here in this room. I don't know about you, but that video was very, very inspiring. I think second only to the Undercover Boss expose. And at the end, when I was laughing, I have to tell you, I wasn't laughing about the motto, but we had assembled all of those people in this room to say, "Together we can." All we had to do was say, "Together we can." And we must have done 100 takes on that. And so we figured it out. We had it down pat, and I was supposed to say, "Together," and everybody was supposed to say, "We can." So the fellow that was doing the tape said, "All right, so now the CEO." He points, and I was going to say "Together," and the fellow behind me said, "Together." So I tried to give him my name tag, and he said, "Not unless I get your salary." And we laughed. So it was a great experience just doing that. But happy Recognition Week to everybody. And if we could only get the same kind of attention for all of the things that we accomplished last year, 1/5 of the attention that we got about Tim Hortons, we'd be so much better off as an organization. People don't know the good things you do, and we are trying hard to get those messages out. And we hope that you will help us get that message out. We're hoping that all of the support that we have to make videos and to put them out there and to celebrate success will be what Eastern Health becomes known for, remembered for, and recognized. And all of you here today are going to help us do that. So welcome, and for everybody who's back at the office keeping the place running, I hope that they appreciate your efforts and that they'll take a moment to say congratulations, and you'll be able to hand a shout out to them for keeping things going while we're here. Setting aside time to acknowledge the hard work of people is an extremely important part of Eastern Health and part of a culture of teamwork and of celebration. We're always going to have challenges, and this year will be no different. However, as we've said, together we can. We can continue to provide focus on high-quality care to our patients, our residents, and our clients. And no matter what your job is, no matter where you do it, whether the public sees you every day or never sees you, we know you're there, we know you're working hard, and we want you to be proud of what you do. I am extremely proud to work with you. During Recognition Week last year, I met the now famous Jeff Andrews. And Jeff, I'm sure you've taken a lot of ribbing over the year. That little clip of you cleaning a tub is YouTube material. I think it's right out there. At last year's CEO Awards, that was the first time I had the opportunity to speak with Jeff, and his acceptance speech left everyone in awe. And it was because of the passion that was in his voice when he spoke about his job. And since that day, I've used Jeff as an example as I tour across Eastern Health, and I know he can be a little sheepish about the attention he gets because of that speech. But he's not the only employee that I've seen who talks with that kind of passion and conviction about what you do. Each and every one of you come to your job with passion, courage, and conviction, and that gets reflected in the work you do. In healthcare, quality work translates to better care. So we need that passion. We need your passion, and we need you to continue to work with us as a team. During Recognition Week, be proud of yourself. Be proud of your colleagues. Take your share of the praise, but don't forget to hand out some as well. Pass along thanks to the people who help you do your work. Our goal at the CEO Awards is to celebrate excellence, and I hope that you will agree with me that today's recipients are very worthy of this honor. And on behalf of the Recognition Committee and the team of individuals who had to evaluate for these awards, I'd like to say how impressed each and every one of us were by the nominations received and the absolute quality of the people being nominated. As Marilyn said, you're already all winners, but only one award can be handed out, so we're going to have recipients today. After reviewing the nominations, I gotta say it was a tough job to decide. But we're going to begin now with the reason we're here, and that's handing out some of these awards. And let's start with the Leadership Excellence category. At Eastern Health, we need individuals who demonstrate strong leadership skills and ability. Individuals considered in this category are not only formal leaders, but they're informal ones as well. Our leaders promote the diversity of people and ideas, of work-life balance, recognition, and teamwork practices. They are mentors and coaches, and they empower and support employees in all phases of their careers. And to help me with the presentation is last year's recipient, Charmaine Lane. Charmaine, good to have you on stage. Did you have a good year?
Oh, great year. Great honor.
All right. So the nominees for the CEO Award of Excellence in Leadership are, and if you're in the room, I'd ask you to stand. Ada Cabot, Regional Manager of Occupational Health and Rehabilitation, who is up for any challenge and works hard to encourage others to realize their full potential. Remember that these are words written by our peers. Krista Dawson, Regional Social Work Coordinator. Krista is committed to professionalism and excellence and understands the individual needs of each of her residents, families, and colleagues. Sandra Gear, Regional Program Coordinator for Emergency Services and Paramedicine Services. Sandra is an advocate for lifelong learning and leads by her own example, keeping updated on the latest practices and approaching every day with an open mind. Fatima Hewitt, Division Manager of General and Thoracic Surgery. Fatima embodies the values of Eastern Health, encouraging staff to take advantage of every opportunity available to them. Barbara Ivany, Administrator for St. Luke's Homes. Barb is described as a visionary who has dedicated her life to ensuring a bright and positive future for the elderly. Maureen Kearley, Program Manager with the Housing Division. Maureen leads with integrity and respect, encouraging diversity and recognizing the value of each and every one of her team members. Scott Leahy, Clinical Pharmacist 2. Scott begins each day with positivity, recognizing the needs of his patients and supporting his colleagues' accomplishments with praise and pride. Peggy Manning, Quality Coordinator for the Biochemistry Lab. Peggy is a problem solver and a quick thinker, maximizing the potential of every opportunity and encouraging her colleagues every day. Elizabeth Mulrooney, Regional Manager of the Alternate Family Care Program. Elizabeth brings honesty and integrity to Eastern Health, encouraging feedback from her colleagues and her clients while offering support wherever she can. Rick Singleton, Regional Director of Pastoral Care and Ethics. Rick was described by his nominator as an inspirational figure as he juggles many hats, always demonstrating compassion, dedication, and loyalty. Tina Skinner, Professional Practice Consultant. Tina was described as a transformational leader who lives each day by vision, mission, and values of Eastern Health. Colette Smith. Colette is the director of the medicine program and is a source of encouragement to many and is faithfully committed to improving the quality of health care in our province and has the good fortune to live in Clarenville. And Linda Thorne, patient care coordinator. Dedicated to providing excellent patient care while encouraging her colleagues through her positive and pleasant attitudes. So those are the nominees for the CEO Award of Excellence. And the winner is, we're going to let you open it.
Okay.
I'm going to get you to open and announce.
Rick Singleton. Yay!
And you get to make a 1-minute speech.
1 minute, I'll just ask, that's hard for me to do. I'll ask Oscar if he's going to recycle that wig to keep me in mind. I need it, but it's actually a minute is more than I can take. I truly didn't expect, or deserve, I guess, this when we consider so many wonderful nominees and so many wonderful people within Eastern Health. But it's wonderful that there is recognition, and thank you to those who nominated me. But it's really about all the people who work in our department and the many people with whom I work throughout Eastern Health in the pastoral care and the ethics service. So thank you all. Thank you.
Congratulations. Well, thank you, Rick, and thank you to everyone who was nominated and for all the nominators for taking the time. The nominations were an absolute pleasure to read. As we go through this, maybe what we can do with the nominees is get everybody to stand, hold the applause till the end, and then we'll have a round of applause for the nominees before we present, if we do adjust as we go along. A mentor is someone who advises, trains, or coaches other employees in such a way that motivates that person to excel. Nominees in the mentoring category have demonstrated a willingness to engage other employees and to seek to guide employees as they look to achieve their goals. So to help me present this award, I'll ask Karen Donovan, the 2011 recipient, to please join me on stage. Welcome, Karen. Nominees for the CEO Award of Excellence in Mentorship are Joan Cranford, nurse consultant with the Community Support Program. Joan maximizes the potential of every opportunity and is a source of positive encouragement to her colleagues and clients. Scott Edwards, clinical pharmacy specialist, an inspirational leader, providing superior knowledge and innovative learning techniques to his students. And Joanne Hapgood, education consultant. Joanne's nominator described her as offering a caring and supportive atmosphere to her students while adapting to better meet the needs of each individual. So, the 3 award nominees. Congratulations. And the winner is. You're going to read that.
I'm reading that.
You're going to read it.
The winner is, drum roll please, Scott Edwards.
Like the two of us. One on each. Yeah, like that. There you go. Okay, good. Mike's all yours.
Thanks so much. being from Ediron Bay, they say I only got 1 minute, but I could probably cover like a book in a minute where I talk so fast. It's a real honor for me, and thanks so much for the nominators. It's a real honor for me to accept the award. I think being a mentor is really important. It's really contingent on a couple of key factors. One is you need to work in a positive environment. I work at the Cancer Center, and of course we deal with complicated patients, but many of our patients say how privileged they are to work with such a great staff, and I feel that way, the privilege to work with our staff on a regular basis. I'm also privileged to work with, and I think to be an appropriate mentor, you had to be surrounded by dedicated leaders, and I live that every day, from my boss Rick Abbott to the pharmacy management team Gary Peckham and the group, to our medical oncologist with Dr. Carol Lang and Dr. Jahan Siddiqui, divisional chief, to our medical oncologists, and all the staff there. I'm really lucky with that, and Sharon Smith, our divisional manager. And also, to be a mentor, you had to be surrounded by and work with dedicated staff. And this group of clinical pharmacists that I work with, they work on a daily basis to help the lives of our cancer patients. So it's a real joy, and it's really easy to be a mentor for people that are really dedicated to improving patient care. So thanks very much.
Nominees in the innovation category have developed or implemented innovative ideas that resulted in a measurable increase in quality, efficiency, and productivity. These individuals created an original idea or uniquely adapted an existing program or process or concept which resulted in a long-term benefit to our patients or our clients and the residents or to Eastern Health itself. So to help me present this year's award, I asked the 2011 recipient, Gail Dix O'Keefe, to please join me on stage. Welcome. The nominees for the CEO Award of Excellence for Innovation are Dr. Peter Barnes, Regional Bereavement Coordinator. Peter brings compassion and spiritual care to Eastern Health through the first ever bereavement-focused clinical pastoral education pilot program in Canada. Kathy Fowler, Regional Wait Time Manager. Kathy recognizes challenges and addresses them head-on, such as the development and implementation of the waitlist strategy for surgical services. Lisa Newhook and Lisa Harding, pharmacy technicians, described as brilliant leaders in the field of compassionate medication dispensing, having developed a program which helps patients in obtaining and dispensing cancer treatments, support, and therapies. And Tanya Purchase, outpatient nurse, and Kyle Powell, social worker, a compelling duo who have shown understanding, commitment, and innovation through the development of the Dialectical Behavioral Therapy Skills Group. I don't know how they can say that, but good work. So, to our nominees this year. And the winner is
this year's winner for the CEO Award of Excellence for Innovation is Dr. Peter Barnes.
Thank you. I want to say a special thank you to Eastern Health. Excuse my emotion at this time, but I just feel very honored to receive this. I want to begin by commending Eastern Health for this position. And the best way to explain or describe this is the meeting I was at last night with 11 people who came for the bereavement information session that I do once a month. And I said, why are these people here on this beautiful night? Like a year ago, I think there might have been 2 at this session, and there was 11. Like, this is a good turnout. And I became aware that Sunday is Father's Day. And so these people were there because they were grieving their fathers. And I said to them, not knowing I was going to receive this award today, I said, I am so thankful to Eastern Health for creating this position that I have. I feel so honored to have it. It's the only one that I know of other than Capital Health in Halifax. And I am so appreciative. And for the vision that I see in Eastern Health having created this position. And so my innovation of trying to build sustainability by having the training of people, taking a program that I've done for over 20 years and adapting it to provide training for people who want to have a specialty in bereavement care is really just piggybacking, I think, on the vision that I feel Eastern Health has. So again, I thank you all. I thank especially my nominator, and I really appreciate the team that I work with, both within the palliative care service, our palliative care leadership team especially, but also my collaboration with pastoral care and ethics, because that's certainly a critical piece of why I've done the innovation that I've done and been a part of a bigger team in order to accomplish this. Thank you very much.
And never apologize for emotion. That's a sign of the passion and the commitment, and I think it's wonderful. The Safety Excellence Award acknowledges a commitment to safety in all times and in all work practices. Nominees participate in training opportunities and show an understanding of safety practices within a specific workplace setting or on an organization-wide basis. So to help me present this award, I would ask the 2011 recipient, Rick Abbott, to please join me on stage. Welcome, Rick. The nominees for the CEO Award of Excellence for Safety are the Bell Island Occupational Health and Safety Committee, a team of motivated, encouraging individuals who are dedicated to improving and implementing safety initiatives. Michelle Cooper, manager of the OR in the Children's and Women's Health Program. Michelle maximizes the clinical safety reporting system to analyze adverse events, promoting a fair and just culture while improving safety. Janice Hearn, registered nurse, focuses her work around the delivery of safe and respectful care, always looking out for the best interest of those around her. The Holyrood Community Occupational Health and Safety Committee, an adaptable team that embraces change while always keeping safety as their top priority. Michelle Q, Regional Quality Assurance Manager. Michelle is described as a strong advocate for safety and brings superior knowledge to the development of safety initiatives. Linda McCarthy Woodrow, Regional Program Coordinator of the Surgical Services Program and a member of St. Clair's Occupational Health and Safety Committee, someone who has demonstrated a significant commitment to a variety of safety initiatives. Patrick Scott Murphy, Hyperbaric Technical Coordinator and Safety Director. Patrick is committed to the promotion of safe practices in the workplace and has been instrumental in developing standard operational procedures for his division. Dale Nixon, Clinical Quality Safety Leader, and someone who works tirelessly to help health providers reduce the risk of harm to their patients while respecting and encouraging patient and family involvement. Rick Scanlon, Manager of Nuclear Medicine. Rick is a devoted member of the Health Sciences Center's Occupational Health and Safety Committee and has been instrumental in addressing and resolving various safety concerns. And Gail Wells, Clinical Site Lead. Gail has implemented numerous safety-focused initiatives and is described as a champion of patient safety by her coworkers. Congratulations to the nominees. And Rick, the winner is...
The winner for the CEO Award of Excellence for Safety is, we don't have a drum roll, Scott Murphy.
Said to Vicky, I'm not a very good speaker, so I prepared something. Thank you. It's an honor to receive this award. Safety is all around us. It affects everything we do. Our health and well-being, our health and the well-being of our patients directly depends on how we apply safety. I'd like to read a statement from NFPA 99, Healthcare Facilities Code. It's a bit long, but bear with me. The hazards involved in the use of hyperbaric facilities can be mitigated successfully only when all of the areas of hazard are fully recognized by all personnel and when the physical protection provided is complete and is augmented by attention to detail by all personnel of administration and maintenance having any responsibility for the functioning of the hyperbaric facility. It was long. But that statement demonstrates that everyone involved in hyperbaric and in healthcare in general has a vital role to play in ensuring staff and patient safety. Thank you for recognizing me for a job well done, but I would also like to thank all the management and employees of Eastern Health for doing their part in ensuring our safety as well as the safety of patients. Thank you very much.
Thanks, Rick. Building community capacity is integral to our success as an organization. Nominees in this category develop, manage, and maintain strategic partnerships with other community groups, volunteers, and/or organizations to better serve our population. To help me present this award, I ask the 2011 recipient, Donna Ronan, to please join me on stage. Welcome, Donna. The nominees for the CEO Award of Excellence for Community Capacity Building are the Community Mental Health Counselors Team. This team has had tremendous success in delivering exceptional counseling for clients with a wide variety of mental health and addictions issues. The Eastern Health HIV Team. This team advocates for their clients who are devoted, I think I've got this wrong. This team provides outstanding support and assistance for people living with HIV and AIDS. The Health Promotion Team. They're a powerful force for change as they work diligently within our communities to improve health status. Maureen Curley, Program Manager of the Housing Division. Maureen, as we mentioned, has brought compassion and determination to many community centers and organizations through her devotion to social work and helping others. The Mental Health and Addictions Outreach, Promotion and Prevention Team, a group of visionaries who have been faithfully committed to providing outstanding services for mental health and addictions issues. And Nancy White, social worker. Nancy understands the true meaning of community as she dedicates her time to helping families overcome the many struggles of life. And the winner is...
And the winner for Community Capacity Building is Nancy White.
have no idea what to say. I didn't think about it. I didn't write about it. This was, I just had to check actually to make sure it was my name called. Have you ever had that dream? You know, and I thought, oh, I'm into that dream, and it wasn't really me. Anyway, I'm really touched by the fact that I was nominated, because I was nominated by the clients that I work with in conjunction with my team. And I cannot begin to tell you how what an amazing group of people they are. They are the families who love and support and nurture and try and protect and try and help heal people who have eating disorders. I started working with them years and years ago when I worked on a unit where the team wouldn't refer to social work for people with eating disorders because they could not imagine what a role a social worker would have with these clients. So I thought, well, that's okay. I'll make my own role. I guess I did. I don't know. Anyway, the families are amazing, and I'm just really humbled. I really genuinely don't know what to say except thank you, and my heart is so full. Thank you.
Congratulations, you did very well. So congratulations, Nancy, and in fact, a round of applause for all of the nominees in that category. The Service Excellence category is intended to reward individuals who are a model and inspiration to other employees in their dedication to excellence in their work. Nominees must demonstrate outstanding dedication to their work while maintaining a high level of commitment to Eastern Health's vision and values. And to help me present this award, I ask the 2011 recipient, Jeffrey Andrews, to join me on stage. Good to see you again. And the nominees for Service Excellence are Twinette Best, Budget Analyst, who is described as having a warm and generous nature that helps put managers at ease when faced with the budget process. No small task. Charmaine Clark, Audiovisual Specialist. Charmaine's caring spirit, dedication to her work, uplifting presence, and drive demonstrates the difference one person can make on the health of our people and our community. Rosalind Clark, Food Service Worker 1. Rosalind's kindness is undeniable and shines through in every interaction with her coworkers, with the residents, and with the patients. Wayne Coffin, Social Work Assistant, who has always been an advocate for his patients and clients and exemplifies the warm-hearted, positive attitude that is so important in his profession. Janine Colbert, Health Information Management Professional 1, who is dedicated to not only providing quality work, but also to helping her co-workers in any way she can to make their jobs easier. Lorraine Courvoisier, Recreation Therapy Worker, described as an inspiration to her co-workers and committed to ensuring all residents at St. Luke's are involved in fun activities and receiving the best possible care. The Day Treatment Program Team, who work hard to develop and provide the best possible service to clients and to ensure that they continue to uphold the values of the organization. Joan Decker, Environmental Services Supervisor. Joan approaches her work with enthusiasm and puts her heart into providing residents with a safe, clean home and staff with a positive work environment. Melody Doyle, Food Service Worker 2, who comes to work each day with an uplifting attitude and shows genuine excitement while completing all of her daily tasks. Gary Evans, Lab Technologist. Gary's sense of humor, his optimism, and his cheerful attitude adds a personal touch to the service experience for his patients and residents. Steve Fitzgerald, Cook 1, who has demonstrated his commitment to providing quality service in various ways, including keeping a running log of all residents' and patients' food likes and dislikes. Jennifer Forward, Occupational therapist, a compassionate, innovative, hardworking team player who has demonstrated unfaltering dedication to clients and patients and employees at Eastern Health. Tracy Harris, Regional Nursing Recruitment Consultant. Tracy has been instrumental in changing the face of nursing recruitment and works with a commitment to excellence, unquestionable integrity, and true passion for what he does. Lynette Humphreys, LPN. She's well known amongst her patients and co-workers for her big smile, her positive attitude, and her dedication to providing quality service while conquering the day's tasks. Keith Jones, orthopedic technician, who works very hard to ensure patients receive the best possible care, all the while brightening patients' and co-workers' days with his compassion and his sense of humor. Laura Lucas, secretary, who demonstrates outstanding dedication to her work through her ability to problem solve, to work independently, and to exert creativity into all of her tasks. Raylene McDonald, therapeutic recreation therapist, who is described by her nominator as providing the residents at Harbor Lodge with superb service each day with a very warm smile in attendance as well. Jody O'Brien, food operations supervisor. Jody is committed to providing quality service and strives to create a happier and healthy environment for patients and co-workers through her work on organizational committees, programs, and events. And Patricia Rideout, Clerk 4, who is committed to providing thorough quality work and is said to be an inspiration to all those who had the privilege of working alongside her. So a long and impressive list of nominees. All worthy of the award. However, the recipient is Jeff.
My honor to present this to Charmaine Clark.
Thank you, Kara, for nominating me, and thank you all for being here. I've worked at St. Clair's a long, long time, and the only reason I'm here is because the Sisters of Mercy gave me a chance at the age of 16 to actually come to work with very little or no education at all. And through the years, Eastern Health has provided me with the opportunity for education to better myself. And I'd like to thank the sisters who always taught me one thing, that we are only here because there is a patient sick somewhere. And no matter what you do, whether you be a director, housekeeping, physiotherapy, every day remember that there's someone there counting on you. Thank you.
And I think we're lucky to be able to count on people like Charmaine. Our final award this morning is the Team Excellence Award. Our largest group of nominees, teams are at the heart of everything we do in healthcare. Last year's winner was the Adult Orthopedic Surgery Team. Please join me in welcoming Team Representative Michelle Alexander to present this award. Welcome. To be considered for this award, nominators were asked to consider the team's impact, innovation, expertise, dedication, performance, quality, reliability, customer service orientation, and flexibility. And I'm sure that you will agree with me that the following nominees are worthy of note. First, the Bariatric Surgery Team, the Dermatology Treatment Center, Direct Home and Autism Services in the urban area, Eastern Health Internal Rating and Review Panel, Management Classifications Work, the Ethics Team, East 3A, Waterford Hospital, Harbor Grace School Team, Home and Community Care Medication Reconciliation Team, Hoyles Escazoni Complex Gene Day Committee, HSC Receiving Department, HTDM Service Desk Team, the Janeway Lifestyle Team, the Learning Behavior Clinic, Long-Term Care Eastern Health Clinical Educators, Neurosurgery Traumatic Brain Injury Team, Psychology Training Committee, Resident Assessment Instrument Minimum Data Set, Site Clinical Managers Clinical Efficiency at HSC, SCMH, and the Janeway. So congratulations to all the nominees. And the winner is...
The award goes to the Janeway Lifestyle Team.
Well, we're completely blown away, and there's a couple more members of our team that were unable to make it today, so want to say hi to Charlene Edwards, who's our rec therapist, and Sarah Critch, who's our physiotherapist. And a big thanks to Diane Reddy, our manager, who has nominated us and been a huge support, so thank you very much, Diane. I also want to thank the Department of Health, believe it or not, for really having the vision to believe in us and giving the opportunity for us to do what we do. And finally, a big, big thanks to all the kids and the families, because we would never be able to do it without their inspiration. So thank you very much.
Well, congratulations to all the nominees and to all the winners in all categories for the CEO Award of Excellence program. It's been my pleasure. It's wonderful to see such good work rewarded, recognized, and nominated by your peers. And I think Oscar said that at the beginning, and I'd reiterate that. It's one thing for an award ceremony to take place. It's another thing for that award ceremony to occur because your peers have said you are the best that they can see to work with. They would work with no others. So you should all feel very, very proud at being nominated, and congratulations to everybody here today. Thank you.
So this is not in my notes. Last year I was blown away by this event, and this year I am as well. And as I sat there, I reflected on what is Eastern Health? Eastern Health are our people. It's you. And do we have a reason to be proud? Do we have a reason to be proud? So once again, we've come to the end of this event. I really want to thank the Recognition Committee for another great job done. And let's give another round of applause, actually, for the Recognition Committee. So we're pretty well there. Before you leave, I would ask the winners of the CEO Awards of Excellence to please come up here to the stage. You have to have your picture taken. No wigs required. And also, I understand that there's going to be a video posted to this event, so, oh my God. The blackmail that's around for me. Anyway, it's been a wonderful event. Thank you for coming, and we'll see you next year.
Thank you.